And just got the go ahead. Let's start. I'd like to introduce Allison Sussman, who's our SLP at Eyas Landing. Take it away.
Hello, everybody. Thank you so much for joining on this Thursday night. I know, it's a national holiday, National Margarita Day. So if you have the choice to pick between learning about supporting our kids and enjoying the holiday, I'm glad you picked me. I'm really excited to talk about this topic. It's something that I'm always thinking about. All the clinicians here at Eyas are always thinking about. So without further ado, let me share my screen so we can all be on the same page. Alrighty, let me just get into presentation mode. Fabulous. So as you guys are probably aware, I will be talking about scaffolding, not the structures needed for construction. Scaffolding is a term, kind of a jargon-esque term that we use to talk about teaching and teaching strategies. So essentially, this is how we help our children to reach an independent and proficient level. One second. They are closing up shop here at Eyas, so I'm sure people are just seeing the lights. So before I begin, this is also in the end of the slide, so you'll see that number 12 up there. But I thought, why wait to the end to start thinking about it now? So I invite you all to take a moment and reflect on a skill or skills your child, your friend, or family member is working on. And think to yourself about how much help you are providing them currently, but how much help they really need. As always, it's always encouraged to just ask them. Some people will be able to formulate their thoughts a little bit clearer than others. So those who might need a little bit more support with that, you're gonna have to go off those cues. And we'll talk about that in a little bit. Just to give some structure to the evening, I broke it up into 5 parts. We're gonna start by going over the terminology, get all that jargon, all that good stuff laid down before we can jump into part 2, which is our hierarchy of help. Part 3 is gonna be our benefits. Part 4, the mindsets that we create and we, manifest in our children. And then part 5, we'll tie it all up. Part 6, a little bonus, will be a discussion. So if you do have any thoughts, questions, comments, feel free to add it into the chat. We will circle back to it. If I do see anything that catches my eye and it is relevant to what we were talking about in that moment, I will go ahead and answer it then. But anything I don't get to, we'll answer it in the very end. So scaffolding, like I mentioned, nothing to do with construction, everything to do with teaching. So scaffolding is the support provided by another person to help individuals achieve or meet their goals. So essentially, it's just the help we give other people, what it looks like, the different types of help, and how we can build up or decrease the help we give others. That kind of brings us to the zone of proximity. So when we're talking about the zone of proximity, this is the set of skills or knowledge an individual can't do on their own, but they can with help or guidance of someone else. It's the skill level just above where the person currently is. It's relevant to the clients here at Eyas, in school, if you have IEP goals, any type of goals, even personal goals, New Year's resolutions, anything of that sort. It's kind of an achievable level. It's something that someone can do if presented with, a prompt or a gesture or a model, but they wouldn't be able to do it completely independently. It's kind of our sweet spot. It's kind of where we look for when we do create our goals. We want to make sure they're achievable. We want to make sure that with, whatever amount of help we give them, that they will be able to achieve that goal. That's how we gauge what's appropriate to work on. So how do we do it? We work with the child or the individual to help them work on their skills by providing them with support. This can look so different based on what you're doing and who you're doing it with. Essentially, to find that zone of proximity, it's going to take work. It's going to take some back and forth. It's going to take some trial and error. That is what we do initially in therapy anyways. We get to know the kid. We kind of see how much help they need. And then we work on providing them that support. So to understand kind of where that limit is, like, are we giving too much help? Are they becoming kind of prompt dependent? Or are we giving too little help where they're giving up on the task and walking away? So finding that appropriate level of support takes time and takes engaging, but it also has a lot of levels to it. So going through them and understanding this hierarchy of help will be so beneficial in establishing how much help you are providing now and where you kind of want to go. So our hierarchy of help. We got this big old pyramid right here, starting with our biggest base. This is going to be our biggest amount of support. That's going to be our physical assistance. That's something like hand over hand. Here we use our GAS scale, our GAS scale. So that would be our max level, starting at the very bottom. So that's going to be our hand over hand. That's going to be zipping somebody's jacket for them, putting their shoes on, brushing someone's teeth, physically interacting with an individual to provide support. Our models are going to be an immediate model. So if you're working on initiating conversation and saying hello, prompting an individual to say hello, that's going to be our direct model because we're immediately providing them with what they are expected to do. Just a basic model would be not that immediate aspect. So we're backing it up a little bit and providing less help than that direct model by just saying hello to somebody next to you and seeing if that individual will get that prompt and understand that that was a verbal cue and a model for what they are expected to do. Partial verbal is a little bit less help than that. That might just be like, oh, I want to say hello to my friend. A gestural cue would just be a gesture, pointing at the skill, pointing at the shoes that they need to put on, gesturing to your mouth to initiate putting a toothbrush in your mouth, pointing at the device so they can carry the device from the living room to the bedroom with them. Requesting a response is going to be essentially asking a question of them. Like, do you have your device? Did you brush your teeth yet? Trying to initiate that like executive functioning skill to begin a task. So this is a little bit less help, but this is kind of at the top because there's that level of they have to start problem solving for themselves. They have to start thinking, no, and I need to do that. So I need to do that by grabbing a toothbrush or whatever the skill might be. Our indirect nonverbal prompt would be something like, I'm going to go brush my teeth. And that takes a little bit more brain power to be like, oh, I need to do that too. And then that expectant pause is no prompts, no cues, no gestures or verbalization on your end. It's just that pause and allowing the person to process what's going on to then initiate the next step. So you can see that there is such a vast variety of supports we can give to any individual. And it's kind of, it can look different and everyone processes them in different ways. So yes, this is going to be a amount of help. However, when we get up and up and up, we're going to be relying on the individual to be initiating and problem solving and sequencing more independently. So this is where we're going to find independence. So when we're going through the hierarchy, as you can see, you can go up it or you can go down. You can provide the least amount of help and then keep providing more and more and more until you find that sweet spot, or you can provide the most amount of help and decrease it until you find that sweet spot, and then you can keep working up from there. So many of you and some who might not know, here at Eyas, we kind of gauge how much help we're providing. That's our GAS scale. That's how, because everybody here can do anything with support. So we want to monitor how much support we're providing, because our goal is to get our clients, individuals we work with, caregivers who are, partaking in education, to the level of independently being able to do this stuff. So how do we find the right amount of help? Kind of touched on it. We want to find our sweet spot where the individual is challenged and doesn't just rely on the prompts. So we want to move up the scale or down it. So I'm going to go into a little bit more depth with the most to least, and then I'll switch over to least to most. I know I put a lot of words on the screen, so if you'd rather just listen to me, do so, or read it at your own pace. So if we're going from the most to the least, this process describes offering more help than required and decreasing the level throughout the task or in consecutive opportunities. So this might look like day one, we're providing a model of the expectation or the behavior, and then day two, we're moving up and up and up. So an example would be Leah's mom prompted her to zip her jacket. So we got that verbal prompt. The next time she put her jacket on at the same time as Leah, so she provided her that model. And then the next time she said, zip your coat. So I apologize. She started with that direct verbal, and then she moved on up. So you can see how she's kind of decreasing the help. If she's prompting her to wear a jacket, she's putting the thought in her child's mind, you need to zip your coat right now. So they're going to follow the test. They're going to follow the expectation. They're being exactly told what to do. The next time, she's relying on Leah to reference what's visually going on in her environment and initiate the task on herself. You can see that's a harder expectation. And then the time after, she just simply told Leah to zip her jacket. She's not offering that visual at all. She's just moving on. So when we go from least to most, we're actually decreasing it. We're adding more and more. So this process describes offering only a little bit of help and increasing it as the individual demonstrates increased need for help. So if you're seeing somebody struggle with something, you're going to offer a little bit more help. The key here is not to just jump all the way down to the bottom of the pyramid, is to understand that there are little prompts and little bits of help that you can offer along the way before you're fully doing the task for your child, for your family member, your friend, whoever it may be. So in this example, Leah's mom asked her to zip her jacket. When Leah was struggling to do so, her mom provided her a gesture. So pointed at the jacket or pointed at the little ends that needed to be connected. When Leah continued to struggle, her mom put her own jacket on as a model. So Leah was offered a visual reference on how to do it. So that's providing more and more help. When I asked clinicians at Eyas Landing, I asked 3, all did say least to most was the technique they preferred to utilize here at the clinic. I will say That is because the clients who come here, we want a challenge. We're here to provide that little bit of challenge for these kids so they are doing work. Obviously, that would vary throughout the day. It would vary throughout the environments they're around. But here, we definitely want to provide clients opportunity to try new things, to try hard-ish things. And if we started them off too easy, then there wouldn't be that necessary challenge. So both approaches are great. They're highly effective and can support those who need. When we think about our most to least, it's beneficial to fade support in the beginning when identifying that zone of proximity. So if you're slowly taking away the help and you're noticing that the individual you're working with is still accomplishing the task at hand, then they probably didn't need all that help, but you kind of got to get there eventually. You've got to decrease it. And it might be largely because of that support you offered in the beginning. They are learning the skill, providing them help with it in the beginning is great. When we go least to most, it's beneficial to challenge these individuals to meet their goals and to learn new skills. We're always trying to work on that problem-solving piece, that initiating piece with our kids. So giving them a little bit less help than they need kind of puts all those wheels in motion. It's also really important to consider some mindsets at play here. So the first mindset that we're going to talk about, you can tell that we're an interdisciplinary clinic here because these are coming straight from the social work department. We talk very openly and freely about everything we're working on, and they thought it was really important that I share this with you all. So let me share. So our helplessness mindset is when one is always provided a high level of support, they begin to become dependent on that support. This can lead to a helplessness mindset, meaning they believe that they require the prompting to complete any given task. So this might present as becoming really frustrated with something or giving up and walking away. This is something they feel like they cannot accomplish and they don't really want to try, or it kind of creates this like big reaction within them. And, I get it. Doing hard things is challenging. And especially when you're being asked to do hard things all day, yeah, I would definitely also have some negative feelings towards it. But if we continue to provide this high level support, always modeling, always doing it for them, then we're never going to help them get to that level of independence that we all so badly want them to achieve. So if we're trying to foster a growth mindset, this is going to be characterized by one's belief that they are capable of achieving a goal and completing required tasks. This mindset is reflective of a supportive relationship with help where they are equally challenged and supported. So a lot of times our social workers will tell us to always use the word yet with our kids. Like, no, you can't, climb up 5 to 10 stairs yet, but you will when we keep working on it. That yet is so powerful because it really is fostering this idea that there will be growth. There is going to be change over time, that you are going to be challenged, but look at you. You're always rising to these occasions. You're always accomplishing your goals, and that's what we want. We do that a lot with just positively reinforcing when things don't go right. So, for example, today I positively reinforced a child who was kind of producing some slushy SH sounds. Even though they weren't fully articulating it correctly, they still were trying, and that in itself is going to foster that growth mindset. It's not there right now, but give it some time. and we will get it. We will grow. We are going to change, and we are going to keep working on it. And I'm going to keep helping you. I'm not going anywhere. This task isn't going anywhere. We're still working on this together. So, in the beginning, I mentioned I was going to come back to this slide where I wanted you guys to think about this throughout my time with you, to reflect on the skill that you're, whoever you're thinking and whoever comes to your mind is working on, and how much help do they need. And kind of just like, I want to discuss it. I'm here. We got some other really knowledgeable people on the chat, and we can take some time and I'll answer some questions. And we can also go through the hierarchy and problem solve. What support are you providing right now at home or clinic or school, wherever you may be, and what other ideas are there for you to decrease the help and create a challenge without fully giving them like the full level of independence. So I'm gonna share my screen so I can see you all now. Apologies for that. And if anybody wants to put in the chat, if that jogged anyone's thoughts, I'll give you a couple minutes to do so. And maybe I'll provide another example while we wait. So another kid I was working with today had a
Allison, we can't hear you. Allison, we can't hear you. No.
Alrighty.
That worked. It's
Yes,
on.
all right. Goofy technology, not always our friend.
Thank you.
Alrighty. I was just discussing, how I was going from the least to most today with one of my childs who I was working with earlier in the clinic today, how they were having a little bit difficulty processing the question, difficulty thinking of how are they going to initiate conversation, in a social scenario that I presented with a visual. There was a verbal prompt there, and I first just gave them a lot of wait time. I'm no stranger to a quiet moment. That doesn't faze me. I don't think that they've stopped engaging even in that first minute. Then I came down and I just asked an open-ended question. What would somebody say if they came up to you? Because sometimes rephrasing it and kind of getting them to think of it in a different angle helps. At that point, they did get it. So you kind of see like how you can go from just giving them a little processing time to then initiating some thought with them, and moving from the least to the most can be beneficial. Did anybody have any examples or anything they did want to problem solve together? If not, I'll open the floor to questions.
Hey, I have a question. Thanks so much for the presentation, Allison. My name is Arlene. I have a 5-year-old kiddo, and I think that we did early interventions. Started when he was about 3 months old, and somewhere as his parents, we learned hand over hand, and we just kept doing it. And so much to the point that he would wait for us to like get his hand so he can move forward with whatever the task is. And then we realized that we were probably doing hand over hand too long. What advice or suggestions would you say that we should look for as parents when you're doing a hand over hand and knowing when to transition from that step?
Yeah, great question. So I mean, I get this question a lot, especially as parents. I think you really just want to help. That's obviously what the goal is. You want to support your child, you want to help them to the most extent. Hand over hand, I think is a really typical way to start with an early child who's learning the procedures, learning that like body mechanics of achieving a lot of tasks. So my advice would be to kind of think about if any visuals, essentially, since he is getting that visual input and looking at you, he's looking for advice, he's looking for a prompt. If you can create, or, if he has any, people on his team, I know you mentioned EI early on. So hopefully he's still got some strong members on that team that can create like a visual for him to understand the steps of the task at hand. I think it's wonderful that he is looking for support and he is looking, to visually reference to get some advice and get some prompting there. To give him something else to visually reference would be really helpful. Even if you are there and there's, no printer nearby, nothing physical you can provide, maybe even a gesture would do to get him to just start to initiate the next step of the task. Um, can I ask you a question? Have you guys tried any visuals before?
Yeah, so I'm one of those parents that will try everything you suggest, and then I have 1,000 things in my house, so I don't know how to
Mhm.
use them and when to
Yeah.
use them. So we
I
we
get
do
it.
have visuals, but how do
Okay,
you
great.
like, what advice would you give for
Yeah.
getting organized with those? Yeah.
Yeah. I think, it can be so overwhelming when you get so many great, great tips. I think if you had to think of like the couple that you are always grabbing for, or where they are, to just create a home for them, to create a spot where to find them in your house, and to just stick with a couple, you can always build up. But when you're presenting so many different things, you're going to kind of lose that consistency piece. And the consistency is super important for our children. Thank you for the thumbs up. I hope I answered your question.
Another question is visual prompting is great and simple. However, this doesn't typically lead to understanding, rather just following what is being showed to the child. How to make a child understand? How do you make a child understand?
Yeah. So I think, okay, I'm just, I'm a visual learner too. I have to read the question myself as well. So visual prompting is great, simple, however, okay, yeah. So I would say I understand what you mean. That prompting piece is going to initiate that action, right? But if we can provide more of like a cue, so this would be more of that like independence piece. So creating that schedule for them where then they have to start initiating the steps for themselves would be really helpful. Also just decreasing that visual piece then. If you feel like they are becoming visually reliant, language is harder to process for some people than visual. So just kind of toying with what is the next step for them, like what is more challenging and what kind of initiates more of that problem solving piece of it. Um, I like to ask my kids, what's next? So when we're leaving the gym because the timer's going off, I turn to them, I say, what's next? And it takes them to now think, okay, well, we gotta get our shoes on, we gotta get our jackets, we gotta grab our things so we can transition to the next thing on our schedule. I do so when I see the tables all messy and they want to bring another toy out. I'm like, oh no, the table, it's full, to just try to get that problem solving piece going for them. I'm not ever trying to really give anybody the answers immediately. I'm always trying to push people to think for themselves. So if a gesture can do so, if you can point to the table and they can see the table's all messy, that in itself is them understanding it needs to be cleaned up. Without saying, you need to clean this table because we don't have room to play with the trains, you're just showing them the problem at hand and then waiting to see if they are processing it. Mac, let me know what you think of that, and we can further problem solve it. Okay, visual is always easier, and that's the issue. Children look for the path that leads. Yeah. I understand what you're saying, that the visual piece, that visual processing in the children is easier. It is easier to understand at times. That is why we provide it as a support. That's why it's one of those really common things that we jump to when kids are having a hard time, is to providing them visual supports for ways to advocate for a break, visual ways that their bodies might be reacting or they might be feeling. So then they can have a visual to kind of create the concrete to the abstract. It's one of those things that's gonna take time and you can fade. But it is a process. All right, let me know if you have any more questions, Mac, before I move on to the next one. I appreciate all your patience, and I hope that even though I'm not answering everyone's question at once, maybe you're getting some tidbits from others that are helpful and you can bring into your own situations. That's always my goal here.
Do you see the one, how do you help kids to notice and care, from Becky?
Yeah, so we talk about that a lot here. How do we create intrinsic motivation? We can give a child a game as a reward every single time. We can give the kid a break in the gym because they accomplished their worksheet. We can always give that tangible, that reinforcement, but creating that why, giving, like, reinforcing you are here to do work so you can get smarter, so you can communicate clearly. That is why. And the best way I've seen it so far in my caseload is celebrating those wins, celebrating it with concrete examples. You did it. You increased your utterances to 2 words. I can understand you so much. I love it. I love your voice. I love how you said that. That is fabulous. Creating that verbal praise and creating that, like, intrinsic characteristics within them goes a long way. Our kids are always listening. They're listening to everything we say, even if they're on their iPads or, doing whatever, and we're having conversations about them, they are taking it in, they're hearing it, and believe that they are hearing us when we are telling them why they're doing so good, why that solution to the problem solving scenario that we just sat and worked through was awesome, and how that will make them a better friend in their classroom, how their neighbor will love it when they come over and play with them because they're so flexible and that they can compromise so well. Um, Kids take a lot of pride when they do something really well, and creating that just like positive speak and positive self-talk will start to establish that like confidence in themselves and like strong ability to continue to strive and do hard things.
Becky also asked, how do you teach your child to use a fork and knife?
Fabulous question. As a speech therapist, I don't do a whole lot of this, truthfully, but we're interdisciplinary here. We're working so close together. So I'm witnessing it, so I can kind of report to you that it might not be where you would start with just anybody handing them a fork and saying, "Here you go." It might be that hand over hand and helping them with that grip. It might be an adapted fork, an adapted knife or spoon. Um, Something with like a bigger rod to hold on to so they can at least get that body mechanics down of scooping it into their mouth. So starting with maybe an adapted option and lessening it over time is totally accessible. And the most important part is functionality. Is your child getting enough nutrition? great. That's what really matters at the end of the day. Yeah, so sorry, I'm seeing comments here. I'm a little distracted. So yeah, so what we're gonna work on is that grip, I would say, with a fork and knife. The body mechanics of bringing it to one's mouth and accepting it fully into our mouth and having that lip closure. And we might just chunk it. It might not be all of that being targeted at once. We might just simply work on that grip at first. And who cares if it gets all over their face, because at least it got brought to their mouth. And then we can keep building up on that skill. I think that is a wonderful question. And I am confident there are a lot of online resources that have some helpful tips on feeding and that fork and knife grasp. I can also direct you to any of our lovely OTs here at Eyas, or through like any of our umbrella companies who can further help and give you some advice. If you do want, I can maybe even find you a YouTube video if you want to message me after. I can include my email.
And they could get any of that adaptive fork and spoons on Amazon, right? Because I think that's where we get ours. Yeah,
Yeah, exactly. Yeah, so that's usually a really great place to start.
perfect. And what about the basic things like flushing toilets?
Yeah, so I know another
The smell,
visual that I'm
yeah,
gonna just say, like, they do go a long way. We have visuals at, some facilities, and they do help to, like, kinda have, like, a checklist. You entered the bathroom, did you close the stall or door? Did you, wipe? Did you flush? Wash your hands? Having that visual, then they go through it and see how to. Obviously, I'm sure you've told them. I'm sure you've said, please, please, please flush this toilet. I don't want to do this anymore. This is just not in my pay grade. This is not my job. But I think that creating some more visuals and creating more independence where they don't need to be told, that they see the picture of the being flushed, maybe will spark something in them, and maybe you can fade because it becomes a behavior that's learned. I hope that works. I hope you don't have to flush many more toilets. All right. My kid is not fond of the sound. Let me go back up. I think I'm missing something.
for I think the toilet flushing.
Oh, the toilet flushing. Yeah, that's a really good question. I am, always learning. I'm always curious about these kind of stuff as well. I would imagine that you're not the first person to ever experience this.
Right.
I can almost be certain of that. Um,
Mhm.
I think that if it is kind of a noise expectation, maybe just like, I don't know, I think building on the tolerance or even just having them advocate that they need help with it would be independence all in itself. Being able to come up to somebody and say, hey, I can't hear that right now. That really would overload my sensory system. I need help with it. That in itself is independently advocating for their needs. And, that is what we're striving for.
Any other questions?
Yeah, I'm loving this discussion. Oh, thank you, Kelly.
Any other questions?
Take your cup of cup, make them drinks from water bottles. Great question. Another really good OT specific question. What I have seen done is adaptive cups. Some they kind of lessen the opening. That will be really helpful. It kind of depends on what seems to be the hardship in drinking out of the cup? Is it that lip seal? Are they having a hard time kind of like forming their mouth to complete a seal where the liquid can get in and not spill all over them? Is it that grasp? If I'm kind of guessing based on Chase's message where he's saying the child only drinks from water bottles, I'm gonna go with that it is more likely probably that lip seal. We can definitely work with a speech therapist on strengthening one's oral muscles to get those into the proper placement. It might be some just like tactile feedback needed. You might need to start by stimulating the lips a little bit so they're getting that input on their face prior to putting a glass to them. That'll kind of just warm up their system a little bit, and that'll be really nice. There's also some exercises that speech therapists are very well versed in, and occupational therapists and nutritional therapists. Some people have done a lot of good schooling and research on this stuff, so they can better advise where the difficulty kind of is with your kid. But I would definitely look into adapted cups maybe to start, um, and go from there. Does that answer your question, Chase? Awesome. Love it. Thank you.
So we have another question. How do you include neurotypical siblings into scaffolding practices with neurodiverse sibling for motivation or modeling?
I love this question. I actually created a blog post for Eyas Landing about sibling support and very generally just explaining diagnoses to siblings because I think it is so important and is something that many families kind of struggle with. How do you get everybody on board and to understand, especially the siblings when they're still kids and they still, this big abstract idea of neurodiversity isn't something that's always talked about, especially in schools, and they still have a lot to learn. And they're also kind of juggling with their own emotions and their own kidness of everything. So I think speaking very directly about it, there is no stigmas here. It is all positive. We don't want to foster any like connotations with it. I also love including the sibling pair, so your child, the siblings, the whole family unit, into one conversation. How much help do you think you need? How can so and so help you? Do you like when so and so tells you what to do? Or would you rather them just like point or just wait and back off a little bit and give you time to process? So, having that open dialogue is going to be so important to get everybody on the same page. Obviously, depending on the children's age, that conversation is going to look a lot different. There are some books I've included on my blog post that can really talk about abilities in such a positive light and can be a really kid-friendly way. I've also included some, I think, some storybooks and some videos on YouTube. So whatever seems the most appropriate for your kid, I would say look at that as a reference to kind of get going with it. Even though it is more targeted at that, diagnosis talk when it's like kind of early stages or like ongoing as things develop. I still think there's a lot of insight there about creating these open dialogues and answering kids' questions about differences.
Awesome. And someone's interested in PEC system for our son. Do you have any brand recommendations?
Fabulous question. Thank you so much. I would love to hear more about the communication needs. When we're thinking about PEC systems, we really are thinking about that functional language because PECS in itself is a physical book or system or binder, however it is laid out. We really want to focus on the functionality of what environments are they in, what are their needs, what are their interests, that kind of stuff. I also love a good trial process too. So I would definitely ask any speech therapist that you are involved with to provide some options so they can have a better idea of what is appropriate for your child. I kind of always tell parents to wait just a second before purchasing anything until that trialing process is done. I will say with PECs, it's a little bit different because those are less pricey than our high end, our high tech, our more like aided support communication modalities. Um, I can definitely do a little bit more digging on my end. I definitely don't know all of the brands at play. In my experience, it's kind of come down to us coming up with our own because parents have been like, I don't really even know. So I can definitely walk you through a little bit better if if I knew a little bit more about what your needs were and also like which ones you were kind of considering. I do love ones that are all like nicely put together, that kind of are harder, that are laminated. So they do have that like variety where you can take them into the bathroom, that you can take them even to the swimming pool in the summer. That kind of stuff is super important. Right, sentences. Great. I love this question from Alicia Fox. I'm going to read this one and then I will definitely circle back to the other ones. So Alicia is asking that her child is 4.5. He can sing songs, but struggles to formulate sentences. And this is kind of common. I personally have been using this approach where I have been using kind of like a remix. I would describe it as I sing my sentences. If we can get the tune, if that is registering in their brain, all of a sudden I am an opera singer and I will sing and I will model in that sing-songy voice because something in your child that's clicking, that's being processed, that's being modeled to them, and they are able to follow it. So I would encourage you to kind of just follow their lead. Obviously, you can't do it all the time, I understand, but consistency is fabulous. And the more you model, the more modalities you present them with. If you add some signs, we do a lot of like mores and finished and wants, helps. We do a whole variety of communication here. So, supplementing it if he or she, they are not formulating those full sentences, that somehow they can like augment would be my recommendation to start, paired with adding that intonation, that sing-songy into your voice a little bit, because hopefully that'll start to kick in with them because they seem to be responding well to it. All right, let me scroll. You guys are asking fabulous questions, and I am very happy with the engagement here. I definitely love that this has become kind of like a back and forth. I'm seeing people responding to others. It's fabulous. I just want to applaud you all and your interest and your engagement in this because it is so important. How to get a 3.5-year-old to start mimicking noises. Great question. I would agree with Mac. Mirror and every noise or almost every noise they make, try to engage with it, try to make it into a communication. I do make a lot of noises with my kids who are just starting with those like consonant vowel combinations. So those are gonna be like ba, and those vowel consonant combinations like ow. Those noises that we're having, I'm making a lot of them. Even though a pig or a cow, let's say a cow's a little bit easier because of the moo. The cow, its label is cow. We know that. That thing's moo to me. That thing is moo because we want to start with that small unit, and I'm going to just go moo every single time we're talking about it. So really just treating every verbalization approximation as valid communication, because it is, and then building up on it by providing more and more models will be a really good way to start. Adding a visual as well, so those signs, those basic baby signs, those basic ASL, whatever you might find to be helpful for you all and functional, whatever their motor modalities are, that's going to be a really good way.
I think we have time for one more question. Anybody?
Fabulous. I really do appreciate all the helpful OTs and speech therapists who are responding to questions. Since you guys are asking so many fabulous ones, it is so hard to get to all of them. So I really do appreciate the collaboration. I think that's really evident of this company as a whole. We're always working together. So I am just very thankful. Alrighty. Thank you, Matt. Yeah, I agree. I think it's always so helpful to have a sounding board. Quick plug for a fabulous social worker here at Eyas Landing. We do have a parent support group, and that's a really good time to start to problem solve, to work through some challenges you might be having at home. Yeah, so quick plug. Don't fully know the schedule of that, but if you are interested, please reach out to scheduling. Great.
You could reach out to Eyas Landing.
Okay, perfect. Yeah, thank you, Kelly.
Yeah, thanks, Kelly. She was quick.
You got it. I love it.
Quicker than me.
Mm-hmm.
Thank you so much, Allison. This was so wonderful.
Of course, yeah. Always
And we
happy.
appreciate everyone coming, and
Oh, sorry
thank
to
you
cut
for
you
putting
off.
in your email. So
Yeah.
Allison just put her email if anyone had any questions about what you guys discussed. And we appreciate everyone's time. And everyone have a good weekend, and a good, nice evening.
Thank you so much.
Thanks, everyone.
Bye-bye. Take care.